Ladies, come, let's talk. No shame on this topic. Now, I want to talk about the signs of a health vagina and the signs of an health vagina. This is a part of the reproductive system. Most of the people usually don't talk about this, but it's cool that you need to know about these signs of health vagina. And it happens that you know the signs of an health vagina, then you need to seek medical attention so that you can be able to be tested and get treated. So let's now talk about these signs of a health vagina. One is that there is no itchiness. You don't have itchiness in or around the vagina. It's very healthy, isn't it? The other thing is what you call the normal discharge. You know, the normal discharge is just whitish. It's non-odorous. It doesn't smell. The other thing is that there's no unusual odors. You know, these kind of smelly things, the foil smelling, it's not there. That's a normal vagina. The other thing is what we call health appearance of the vagina. How does it look like? Just pinkish in color, you know, there's no swelling, no rash on the vagina or around the vagina. It's just normal. That's a normal health vagina. You don't have any swelling around your reproductive health around your vagina. You know, there's no any rash. You don't itch. You know, all these are just for the normal health vagina. The other thing that is comfortable when you are having sex, when you engage in sexual activity, there is no any discomfort. You don't have pain. You know, that's normal. It's a normal vagina, isn't it? The other thing is what we call the regular periods. You need to menstruate, you know, and it should be relatively constant. There's no spotting, no bleeding in between. So you need to have regular periods. That's normal vagina. It's a health vagina. So these are the signs of health vagina. You know, like having, you don't have any itchiness. There's regular periods. There's no any odorous smelling. Then you know that this is a normal vagina. Now, there are those signs of an health vagina that you need also to be aware of as a lady. If you haven't subscribed to this YouTube channel, there's a lot of things that you are missing. Remember to subscribe. Remember to share this information. You know, like this video if you just find it so helpful for you. And remember to just leave a comment, you know, so that we can be able to continue making these health videos. Now, let's dive into these signs of an health vagina. Abnormal discharges, you know, greenish discharge, you know, and the other thing is thick gray discharges. Then you need to be checked. You know, these are this might be some other conditions coming in. You need to go to the doctor. You need to be checked. You need to make sure that you consult a doctor about these abnormal discharges that were not there, but now you can be able to see them. It's very thick, grayish, you know, greenish. You need to be checked. You know, the other thing is what we call itchiness. Now you have started itching yourself in the vagina or around the vagina. It is not there, but it has started now. There is itchiness. This might be some other sexually transmitted disease. It might be some other infections. You need to be checked. You need to see a doctor. The other thing is pain during sexual intercourse, some discomfort during having sex, during urination. You know, then again, this might be due to bacterial vaginosis. It might be due to sexually transmitted disease, urinary tract infections. Now you need to see a doctor. You need to consult. You know, so you need to know these unhealth signs of unhealth vagina so that you can be able to seek health medical. The other thing is what you call, if you are having what you call bleeding between periods, you are getting your periods regularly and consistently, but again now you experience some bleeding before in the periods, you need to see a doctor. It might be hormonal, it might be other conditions that are coming in, and you are not able to differentiate what are these conditions. You need to see a doctor for you to have a good diagnosis. The other thing is persistent dryness. Your vagina is becoming dry. You are not in menopause, and you just realize that your vagina is becoming dry. You feel so painful when having sex, and all other issues. Those theses might be health related. You need to consult a doctor. You have swellings, what you call the warts, herpes, and some other sexually syphilitic ulcers on your vagina. Now this is not normal. You need to seek medical attention. So these are the signs of abnormal, what you call an health vagina. Once you know the health vagina, then you understand about the unhealth vagina. You can be able to go to the doctor. You can be able to seek medical attention. Remember to subscribe to this YouTube channel. There's a lot of things that you're missing if you haven't done so. Remember to leave a comment, share this information also. Now this is the end of this video. Remember also to support us. Our number is on the description. The little support always keeps us going. Kindly support. Kindly remember to share the information. See you in the next